Hi, I'm Dr. Michael Woods, and I am a urogynecologist, which is a specialist in pelvic floor disorders. I'm also board certified in obstetrics and gynecology and obesity medicine. And here at Manning, I've been serving the community for over 30 years. Urogynecology is actually a newer subspecialty. In 2013 is when we were able to first become board certified in this, and I was one of the first 700 people in the country to become board certified specifically in this. And then in 2018, I became board certified in obesity medicine as well. So I concentrate more on gynecology, and specifically urogynecology is what I would call my forte. And so this is pelvic floor disorders. And so it can be pelvic pain, it can be bladder control issues. And bladder control issues are not a normal part of aging. And whether it's contraception, whether it's somebody that wants to talk to me as their young girl approaches adolescence and things, and trying to guide them. And when it comes to the more what I would call pediatric phase, I have 8 daughters, but I can speak through a dad's eyes as well as a doctor. But whenever I meet with a patient, I want to meet them where they're at. And so I want to give them the options because there's lots of choices. And what's good for one person may not be good for another. Whether it's surgery, physical therapy, making sure we have the resources to address those issues. And we know from aging that activity and social interaction are incredibly important for good aging. And so if we can address that issue, we might be able to address other issues as well. So I try to look at it from that whole perspective, not just the urine loss. What we're offering here in Manning actually is very rare in rural areas. There's about 1,000 board certified urogynecologists and less than 1% practice in rural America. What we can do here is the same exact thing they can do at Mayo. It's the same exact thing they're doing at Harvard. Here we do periurethral bulking, which is where we inject a substance underneath the lining of the urethra to narrow it. I tell people it's kind of like putting a nozzle on a hose. There's mid-urethral slings, and those I've been doing for over 20 plus years here. Then there's pelvic reconstruction, hysterectomies, laparoscopy, chronic pain management, and then looking at treatments for some of the chronic pains that we may not understand completely, but we can improve those women's lives and the lives of their families. So if there is a woman sitting out there that is experiencing bladder control issues, pelvic pain, gynecologic concerns, painful intercourse, or concerned about their weight or their overall health, I'm very available, and I really want to serve the communities. We are not touching the surface of what we can offer, and I want to make sure that people have a quality of life so they can be parts of their community, parts of their family, and just move forward. I'm going to stand beside you, and I'm going to listen to what you have to say and try to address the issues. And if I don't know, I will tell you, and we'll do our best to find out together.
Manning Regional Healthcare Center, your trusted experts close to home.